Hi everyone, welcome to our MR Safety Training YouTube video. What we'll be doing this time is first aid. Okay, we do lots of different courses, as we can see from the banner here. Lots of defibrillation, health and safety, food safety, etc. If you want more information about them courses, then go to our website mrsafetytraining.com. So first aid is the immediate medical assistance given to a person who's become injured or taken ill before the arrival of qualified medical assistance. Now we all know that to ring an ambulance in emergency, the number would be either 999 or 112. 999 works all over Great Britain, 112 is anywhere in Europe that you might be. But when we come across someone who has an injury, it's important to go through what we call triage. So tri meaning three, so we have the three B's, the general order of priority. So the first B, I have my card here, which stands for breathing. If a casualty is not breathing or has breathing difficulties, they're the ones that come first. If a casualty is breathing normally, we'll then look for any severe bleeding, because if you lose too much blood out of the body, you'll go into a medical condition called shock. In fact, hypovolemic shock, which is where the body loses too much oxygen outside of it, so the vital organs start to shut down. If a casualty is not bleeding severely, we go for any burns or broken bones. In fact, any other form of trauma that could send the casualty into a stage of shock. Okay, but breathing always comes first. Okay, now you would think that, and that's in theory, but some cases we have to improvise and adapt to the situation. For example, if a casualty has a really severe bleed and they're losing too much blood out of their body, in that blood is the oxygen. If we start focusing on their breathing first and start pumping on the chest to do CPR, what you're pumping out is exactly what they need to stay in, is the blood. Okay, so if they have a really severe external bleed, you're pumping the blood out, and of course we need that to stay in to feed the vital organs when we do the pumping. So in some cases, it might be address the bleeding first if it's really severe. Okay, don't waste time, do it really quick, block the wound, block the exit, and then focus on their breathing. Okay, so once we've assessed that situation, we then need to think about the casualty and what type of casualty are they. Okay, so onward to our mannequins here. So first of all, we have the baby. Oops, child's just fallen on the floor there. So the baby is technically an infant, anyone age newborn to 12 months. Okay. If we have the child casualty, this is technically anyone aged between 12 months and puberty, which can vary depending on the casualty. Basically, someone who's a lot smaller than us, and it's obviously a child, we therefore treat them as a child. And adult would be anyone who's post-puberty. Okay, so from the age of say 11, 12, 13 upwards. Okay. Now remember, on all our first aid courses that you may go on, okay, I'll just stand up for this one, each person does receive a book. Now depending on who we want to tailor our course to, if we're doing an adult first aid course, each person would get either the A5 first aid book, or if we were doing a first aid at work course for 3 days, then they'll get the full A4 book. However, if their needs assessment says that they need a certificate in paediatric first aid, they would get the A5 paediatric first aid book. Okay, so lots of different resources to help us with a course. Okay, so going back down to our mannequins then. Okay, what we're going to go through is something called a primary survey. Now, a primary survey is initial assessment on someone who's collapsed on the floor. Depending on our findings with this determines what comes next. Okay, now what we eventually get to is CPR. Now that will be in another video. We're just going to focus on the primary survey. The first thing is checking for dangers. Is it nice and safe for us to approach? If it's unsafe, make it safe if you can without putting yourself at risk. If you cannot make it safe without putting yourself at risk, phone for help. And if that is the most you can do, that is the most you can do. So we're checking for dangers. Is it nice and safe in this room? Okay, which it is. So we're going to come up and we check for response. Okay, now some Training providers use a scale called AVPO to check for someone's response. Are they alert? Do they respond to voice? Do they respond to placing pressure? If not, they're unresponsive. I call it the tap, talk, touch. Okay, so we tap both shoulders. Okay, make sure we do tap both, because if we just tap the one shoulder, the casualty might have had a stroke and therefore not feel. So we tap both. We're talking loudly in both ears. Hello, are you okay? Can you hear me? Open your eyes. Now it's important to give someone a command rather than just a question, because people do tend to respond better to commands rather than just questions. I also personally touch the forehead as well, because what if a casualty has collapsed on the floor and hit the head off the floor and potentially caused a spinal injury? Now, if they've damaged the cervical spine at the back of the neck, they may become what's called tetraplegic, which is paralysed from the neck down. So therefore, if you don't make contact with the forehead, if you just tap the shoulders, there's a chance they may not feel. So we're trying to cover as many bases as we can to get a response. We then open the airway. Our hand goes on the forehead, 2 fingers under the chin, and we tilt the head back. And what that simple manoeuvre does is it brings the tongue forward from the back of the throat. Okay? We then check for the breathing, look at the chest going up and down, listen over the mouth and nose, and feeling with our cheek, and we do so for 10 seconds. Now, my little tip, I always lick my finger and wipe it on my cheek, because it's easy to feel someone's breath on a damp cheek than it is a dry cheek. So, going down, have a listen, have a look, have a feel for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And do make sure it is a proper 10 seconds, not just a couple, because in that couple of seconds you might have heard a breath, you might have felt a breath, but that could be what's called their agonal breathing. In other words, their dying breaths, okay, their last breaths. So it's important to check for 10 seconds to say yes, the breathing, and the breathing is at a regular pace. Okay, it's either nice and slow or it's quite fast, but it's their normal breathing for the casualty. Okay, 10 seconds is important. And what we've done there is a primary survey called DRAB. Check for dangers, check for response, open the airway, and check for the breathing. And that has been on an adult casualty who's post-puberty. Okay, now in a future video, all we'll do is we'll go through what to do with a child and what to do with a baby. So check out our other video, and also make sure you do like our Facebook page, MR Safety Training, and follow that as well. Okay, thanks for watching, and look out for our other videos.